Neonatal abstinence syndrome, or NAS. What is NAS? NAS is a group of conditions caused when a baby withdraws from certain drugs, most often opioids, exposed to in the womb before birth. NAS may lead to long-term health and development problems, including hearing and vision problems, and problems with learning behaviors. Withdrawals can also occur from benzodiazepines, barbiturates, and sometimes SSRIs. Signs and symptoms of NAS include body shakes or tremors, seizures or convulsions, overactive reflexes, twitching, and tight muscle tone or hypertonicity, fussiness, excessive crying or having a high-pitched cry, poor feeding or suckling, slow weight gain, breathing problems, including breathing really fast or tachypnea, fever, sweating or blotchy skin, trouble sleeping, lots of yawning, diarrhea or vomiting, stuffy nose, or sneezing. Reporting of NAS. In addition to signs and symptoms, the following toxicology results are reportable to DHHR for surveyable purposes. Toxicology indicating positive results for any opioids, benzos, or barbiturates in any specimen from infants less than 28 days old. Toxicology indicating positive results for any opioids, benzos, or barbiturates in maternal specimens in 4 weeks prior to delivery. If toxicology is positive for any opiates, barbiturates, or benzos, positive results for all substances should be reporting. In West Virginia, it is not mandated to report to DHHR other than for surveyable purposes. The mother of the child cannot lose custody or cannot be held triable due to these results. What is the maternal ethical dilemma? The maternal ethical dilemma lies with whether or not the mother should have rights to the baby if it is born with and diagnosed with NAS, or if it should be considered a case of child neglect or child abuse. Child abuse in West Virginia falls under any of the following categories: actual or attempted intentional infliction of physical or mental injury upon any child in the home, sexual abuse or exploitation of the child, the sale or attempted sale of the child, or domestic violence. Any of those would fall under child abuse in the state of West Virginia. Another point to bring to light is the mother is in a treatment program prescribed Suboxone or methadone. The baby will still go through withdrawals after it is born. So would this be considered abuse even though the mother is trying to get help? So within the maternal ethical dilemma, there is an obstetric ethical dilemma. That is whether or not the obstetrician should drug test periodically or even one time randomly during the prenatal period. And is it ethical to do this to these pregnant women? They test for hyperglycemia without any stipulations in order to better care for the baby once it is born. So if the mother does not adhere to a diet plan and the baby is born severely hypoglycemic and jittery, she's not going to be prosecuted or charged with child neglect. However, if a mother who was to have a positive drug screen, the obstetrician would have to report that as child neglect in certain states, and the mother could be charged with this. So is this ethical for them to do drug tests for pregnant women as they would a hyperglycemia test? My personal views on this dilemma are that once they find out that the mother is actively engaging in substance use, that CPS should be called to ensure the safety of the child. since the mother cannot safely care for that child in utero, I would imagine that the child is not going to be cared for once it leaves the hospital. I think it is a great idea for those who are in treatment programs that are trying to get better to remain on these treatment programs and try to advance their lives and adhere to the random drug screenings in order to be able to keep their children. Now, if a mother were to fail to remain substance-free, then all rights should be lost except a supervised visitation. The opposing views to this ethical dilemma on whether or not the mother should get to keep the baby and whether or not obstetricians should have to prenatally drug screen in order to better care for the baby is that the mother should be able to practice autonomy in declining that drug screen unless the baby is at a severe risk or there's no fetal movement, etc. Also, the opposing view in removing the child from the mother's care is the lack of foster care availability. A lot of times the children get taken away but end up back with the mother because there's not enough care to place these children into. So who are the stakeholders in this ethical dilemma? The first stakeholder is the mother and her rights to being a mother. The mother has carried the child for 9 months and has kept it alive in utero for these 9 months and is very interested in keeping the child and agrees to a treatment program. She doesn't want to lose her child and wants to be able to care for her child like a mother should. The other stakeholders include the hospitals, the states, and the staff of the hospitals. There is an increase in hospital costs for NAS babies due to their time spent in the NICU or prolonged hospitalizations. Many of these babies are signed up to receive Medicaid benefits, which is costing the state money to pay for these prolonged hospitalizations. And lastly, the moral distress of the staff caring for these NAS babies. When they became nurses, they took an oath of beneficence and non-maleficence, and there's only so much one can do for an infant going through withdrawal. You can provide pharmacological treatments or non-pharmacological treatments, and one or the other may be effective or neither may be effective. So the mental stress and burnout of these nurses is extremely high. A few points to take into consideration. In 2018, 49.6 out of every 1,000 babies born were hospitalized NAS babies in the state of West Virginia. The cost of a hospital stay for an NAS baby was 5 times that of a baby born without NAS. Costs totaled $65.4 million for all infants with NAS who were covered by Medicaid in 2004 and increased to $462 million in 2014. Here is an example of a NAS baby in the NICU and a non-NAS baby. Where do you side?